Good morning. It's an incredible pleasure, and also I should say intimidating experience to speak to such an audience, because I find that people like yourselves who are interested in melanoma, often for either the right or the wrong reasons, often know a heck of a lot more about this than we do. So I just want to share some of my thoughts on where we are regarding prevention, screening, and detection. So I have no relevant financial disclosures. Nobody's paying me to speak. I will say I have a lot of personal conflicts of interest because I, like many of you probably, I hate melanoma. I want this disease just gone. I have been in dermatology now for 20 some odd years, and I remember the very first melanoma we saw when I was a resident, and I came out and said, oh my God, we saw a melanoma today, and everybody was, ooh, ah, isn't this interesting? And it's gone from being a, wow, this is cool, we read about this in the textbook disease, to, oh gee, how many did we see this week disease? And that isn't good. I have, however, just had the incredible privilege, particularly over the last 10 years, of working with some amazing groups and people like Valerie's organization to make a difference. I have worked in patient advocacy. I do a lot with the American Academy of Dermatology on the political side, and I've sat in congressmen's offices, and I had the incredible privilege of leading the fight in Vermont before I came here to help outlaw indoor tanning for minors. And that was probably one of the most fun things I've ever been able to do. And if I look back over what I've accomplished in my career, that's one of the things I'm most proud of. You cannot tan in the state of Vermont now as a teenager. So we'd like to get there in Tennessee. So as you know, melanoma is much too common. I don't have to tell you this. And we're seeing the graph is going in the wrong direction. Now the good news is I think we are doing a lot of right things. So hopefully we will start to see this incidence plummeting at some point. This is a statistic I'm sure you're all familiar with. How many new cases do we expect to see of invasive melanoma in the US this year? About 76,000. And unfortunately, some of those will not have a good outcome. And this is a statistic that none of us like. 1 in 5 of us, depending obviously on your skin color, will develop melanoma. The only consolation I take here is Australia is still worse, but that's not good either. What about Tennessee? Well, we're expecting to see about 1,800 cases of invasive melanoma this year and associated about 250 deaths. It's not good, it's not bad. But here's the good news, is many melanomas are detected at an early stage. And if we get them early, as I like to tell my patients, if we get this early, we can cut it out and be done with it. And the really, really good news is even when we don't have that opportunity to one and done it, if we will, get it gone, we have many, many more outstanding treatment options than we did even a decade ago. And I think that all of us who are very passionate about eradicating melanoma are working hard to do everything we can to get rid of it. So here's an interesting question. Who finds a melanoma? Well, for the most part, patients find their own melanomas. So I think over 50% of melanomas are brought to us with I'm worried about this for some reason. I've learned over the years that I can follow all the guidelines for making a diagnosis, but one of the most important to me is when a patient or their family member walks in and says, you know, I don't like this thing. And I can look at, so many times I've looked at a lesion and said, you know, it doesn't really curl my toes, but let's get it off because you don't like it. You know, either patients or I have a very good guardian angel, because I think that instinct is often very good. And family members are wonderful at looking at that. This was a gentleman I diagnosed as a melanoma because his girlfriend beat him over the head and said, that thing on your back, there's something wrong with it. And she was right, it was indeed a melanoma. And healthcare providers are pretty good at finding these. I think dermatologists are good. We're working hard to try to make sure other healthcare providers who are not dermatologists are equally as good. Some of this is just encouraging them to make sure they take people's clothes off. So, and then I have the obvious other side, which is to make sure dermatologists actually look in places where they don't normally take their clothes off. mean, I'm trying to get dermatologists to look at vulvas. It's tough, but I remind them over and over, there is skin there too, so take their pants off. So patients tend to find more melanomas, but those detected by healthcare professionals, possibly because of our screening bias, may be detected earlier and thus may have a better prognosis. So I want everybody to be looking for melanomas. So how do we find them? Well, clinical suspicion really remains the best way to find a melanoma. I'm sure everybody here is familiar with the ABCDEs, the asymmetry, the border irregularity, the color variegation, all these things. Diameter we probably could get rid of because I've removed plenty of 3 millimeter melanomas and ignored a lot of 1 centimeter atypical moles. And frankly, I'd rather get them when they're small, but it's really hard to go ABCE because evolution turned out to be a very important thing to add. The changing mole is the one that always catches my attention. I think also this concept of ugly ducklings has turned out to be very important. And I don't know if you guys are old enough to be getting all the barnacles that you start getting when you hit 40 and 50, but yes, I'm seeing some heads nodding. It's tough. I mean, you know, look at your average 50, 60-year-old. We have things and they look weird, and how do you know which one's the bad one? Well, one of the things I stress to my patients is if I have 20 weird-looking things, I'm far less worried than if I have one. And this was a woman who had a lot of barnacles. They're not really showing up well here. But then she had this. Well, that's obviously an ugly duckling. It was bigger, it was darker, and you know, innumerable times I've seen something that was just a little bit darker and it caught my attention. And that's obviously, or sometimes the melanoma. So I like the ugly duckling concept. So is there anything that's better than just looking? Well, there are some non-invasive diagnostic technologies that are evolving, and I think, and I hope that these continue to grow. I know some of my colleagues are doing some outstanding research in this. Total body photography is a very useful and helpful way to monitor people. If we can follow pictures, and this is a picture I stole from the internet from Memorial Sloan Kettering where they're doing 3D total body photography. If you can watch, it's very helpful to find a mole that wasn't there last year that's all of a sudden there this year. That might be the one that's evolving, or that might actually be a melanoma. So dermoscopy is another very helpful tool, and I hope your dermatologists use this. This allows us a better magnification that looks at the surface of pigmented lesions, and we use the patterns that we see to help us identify benign or cancerous changes. Is it perfect? Is it a biopsy? No, it's not. But it can give you that my toes just curled feeling that makes you know that this is the spot you need to biopsy. In fact, in many cases, it can help you not have to biopsy something because you can see reassuring changes. The logistical problems, and many people have come to me after similar talks and said, well, my doctor doesn't do total body photography. And here's the sad reality. Logistically, this is challenging to do, in part because people and insurers don't want to pay for it. It takes a lot of time. It needs a photographer if you're going to do it right. And then you've got to have the time to actually sit down and compare the old images with the new images. In our present healthcare system, nobody pays for that. So if you're in a setting where they can do it, I say wonderful, but please don't be too hard on your docs if they're not. We also honestly don't have the optimal software technology available to most people to do this well. Will we in the future? I hope so. And I'm hoping as we're changing into different models of healthcare delivery in our new world of healthcare, hopefully these will be the kind of things that we understand that this is really important, and it is cost effective to do this because this will hopefully help me pick up the melanoma earlier and then cost the system less and ultimately benefit all of our patients, which is what we're really trying to do. There's a whole host of newer technologies which we can read about, we get incredibly excited about. Unfortunately, the reality is many of these right now are still in investigational stages. including the melanoma sniffing dog, which I'm just dying to get. I tried to teach my own dog to sniff melanomas, but he's not really excited. He is cute, but I didn't bring a picture of him today. The good news is these are all being investigated, and some of them are coming to the market. Again, there's price tags attached to this, and in many cases, there's just logistical issues with them. There's some devices that you can put on a melanoma, and it'll give you a nice 3D scan of what it looks like that'll give you a hint whether it's a melanoma or not. But if you have to sit and hold it on a particular single lesion for 10 or 15 minutes, not practical. But you know what? The more research we do in this, I think the more likely we are going to find that magic toy that'll let us put you in a scanner that says, ooh, biopsy this one and this one and this one. I think we're a lot closer to that than we used to be, and I think I'm very excited that this research is all going on in hopes that we will find that perfect device, or maybe just the perfect dog. You know, I'm sitting here with my smartphone. I have a 15-year-old, so you can imagine somebody in my house always has a smartphone going. So I think this is an opportunity to bring technology out of the office, out of the lab, and directly into the hands of our patients. There are smartphone apps out there that will promise to find your melanoma. Does anybody here believe that? I hope not. But it's perhaps an evolving technology. There are different qualities of smartphone apps. You know, I think the idea that, oh, I can take a picture and send it by my smartphone and somebody will tell me if it's a melanoma, may be an evolving technology. This particular study that was done in 2013 looking at the accuracy of some of these did not show that we're there yet, or let's say it showed that we're not quite there. They missed quite a few of the melanomas. But does that mean we need to put our smartphones away when it comes to looking at melanomas? Probably not. And my colleague and friend Sancy Leachman at OHSU has created a Molemapper that can be used, I think, appropriately as a research tool. What we're trying to do is to see if you can follow your moles and measure its changes and is it growing. You can actually download this, and it allows you to measure your moles, and if you're willing to participate in her research, and I have no conflicts of interest with this, I think it's just kind of cool. You can kind of follow your moles, and we're going to see how can we best use our smartphones to watch for melanoma. So I think it's a technology in evolution, and I'm excited about the opportunities to use it. So stay put. Maybe someday we'll have that perfect app. Obviously, I think just looking remains key, and this has been one of my big messages. If you don't look for melanomas, you're not too likely to find them. It's somewhat of a self-fulfilling prophecy. My colleague and friend, again, June Robinson, has shown that doing partnering with your partner, whoever that might be, is a pretty good way to look for it. I don't know about you, but I'm not terribly adept at stripping myself naked and looking with a mirror and 3 mirrors to try to find everything, but partners are pretty good. Although in full disclosure, I will say I've had 2 physician partners miss melanomas. But at least, you know, so nobody's perfect, but at least looking and seeing, and, you know, do you get that thing that catches your attention? So I tell all my patients, go home and strip naked with your partner and have fun, but make sure and look at what you're doing. So now the bigger thing that I reel about, and I'm fairly self-righteous about, is actually getting other providers to do exams. I'm probably not going to teach my OBGYN husband to be a perfect dermatologist, but I have talked to a lot of OB colleagues and pointed out that young women are getting melanoma. And which doctor does a young woman see? The OB. You've already got her naked. Just take a look while you're there. So one of my passions is someday to team up with ACOG and do an educational blitz to teach OBGYNs what should catch your eye and what do you need to send to me. But just reminding them to look. So I think that's really important. If you don't look, you don't see. So this somewhat begs the question, who should we screen, and should we be screening everybody? And well, this is where my bias is. Of course, a dermatologist thinks we should be screening everybody. Why? Because we all believe that screening will save lives. Unfortunately, the literature isn't totally clear to back us up on this. There are some studies that have shown that in populations, there was a study recently in Germany that showed that from the time they studied that there was a definite decrease in mortality when they did total body skin exams. Unfortunately, it's not shown that this result is going to hold up, because over the next few years it may or may not be. So I think the perfect study hasn't yet been done. And the U.S. Preventive Services Task Force, which is a group of volunteer experts who get together to look at what kind of evidence we have for doing any of the things we do. That's the group that comes out with like recommendations for when we should do our mammograms and whether or not we should check our PSA to look for prostate cancer. They actually just did a study to look at the evidence to justify doing skin cancer screening on all people. And what they concluded is this, is that only limited evidence was identified for skin cancer screening, particularly regarding the potential benefit of skin cancer screening on melanoma mortality. Well, unfortunately, some people in the press immediately took this and said, oh, you don't need to do your skin screening because it doesn't work. Well, that's not what this says. This really says is we don't have the evidence yet to justify what we want to do. So I think the answer is we need to keep studying it, and we are doing that. Now, what they went on to recommend is that we really needed to perhaps focus our research on the effectiveness of targeting our skin cancer screenings on people who are at high risk. So I think that's reasonable. But I think really what this tells us is we need to keep looking. And I promise dermatologists will keep doing that, as will our oncology colleagues. So who's at higher risk for melanoma? I meant to put a picture of myself in here because I am absolutely a melanoma poster child. Exposure to ultraviolet light, number and types of moles, eye, skin, hair color. I used to be blonde. Now, thank goodness, my hairdresser helps me. But I have light skin, light eyes, and I have sustained numerous blistering burns. Haven't had a melanoma yet, but I keep looking. Personal history of melanoma or other skin cancers is itself a risk factor, as is having a weakened or abnormal immune system. Unfortunately, we're more likely, if you live long enough, you're more likely to get a melanoma. Being male is a risk factor, as is having an underlying genetic condition that increases your risk, and many of you are familiar with those. I think it's more interesting, though, if you break these down into the risk factors that we're stuck with. I mean, I can change my hair color all I want, but my risk isn't changing. And I just got back from Seattle where I saw some interesting hair colors. But I'm not nearly hip enough there. But compare those that we cannot change, that we're stuck with, to those that we can. And it really comes down to one thing: our exposure to ultraviolet light. I could talk for hours as to why ultraviolet light causes skin cancer. And in fact, that's actually what turned me from an internist into a dermatologist, was my interest in that. But let's all agree that ultraviolet radiation is a risk factor for skin cancer, including melanoma. So then how do we avoid it? Well, I spend hours telling people to avoid the sun. I used to spend a lot of time telling them to stay out of the sun, and then I realized that was really stupid for somebody who was a competitive bicyclist who was out in the sun a lot. But I did show them that I was at the end of summer and I had no tan, which actually meant I was doing something right to protect myself. So I no longer tell people to stay out of the sun. I tell them now to keep the sun off of their skin. And I think that's probably a reasonable strategy. So we're not trying to make people into bats. We're trying to teach them to practice safe sun. And these are all simple things you guys all know probably much better than I do. Obviously, avoiding the peak exposures, wearing clothing and hats. In my mind, clothing always trumps sunscreen. It's less messy and it's easier to do, and it frankly works better. And don't forget the sunglasses, because we don't like melanoma in the eye either. And then wearing high SPF sunscreens that block from both UVA and UVB. And there's the real trick, because finding a sunscreen that you like is really key. There's lots of great ones out there. The best sunscreen is the one that you or your husband or your wife or your kids will actually wear. If it smells girly, my husband will not wear it. So, I think the industry has done a great job of recognizing and responding. So as far as I'm concerned, there's no excuse to not put on a sunscreen anymore. And the other recommendation is just don't tan, ever. Can wearing sunscreen prevent melanoma? Well, this is another complicated issue that probably is right up there with does screening work or not? Melanoma, the etiology is obviously quite complicated, and there's often probably more than one contributing factor. Use of melanoma has not conclusively been shown to prevent melanoma, but honestly, we really haven't done the perfect study. I mean, when you think about it, if you take me now at this age, put sunscreen on me for 10 years, and look at the end of that 10 years and say, do I have a melanoma or not? That may be helpful, but it doesn't do anything for those 10 years that I grew up on the Eastern Shore of Maryland getting fried every single weekend. So I think the perfect study is going to be hard to do because all of those lifetime factors are going to really potentially play into who gets the melanoma and who doesn't. So I think the perfect study is hard to do. Do I believe this? Yes. And are there some new studies that are showing some benefit? Yes. There's some studies that are showing that at least it may delay it. So this one I'm going to have to go with faith and believe that sun protection does make a difference and that sunscreen use is an important part of that. So what can we do? Well, we can try to minimize tanning for ourselves, for our patients, for our families. This has been my particular fun place, as I said, my political playground has been to help with the war against indoor tanning. I'm very proud to say that many, many people, groups, organizations like AIM at Melanoma have been incredibly involved in the war against indoor tanning. And we've had some great successes. And it's been very exciting to see all of the interested parties come together and have some great successes. And frankly, it's fun. I love chasing, sorry about the political thing here, but I'm gonna say I've loved chasing some of the tanning industry people down their little rabbit hole. But it's really been fun, and I think we've started to make a significant impact on the indoor tanning industry. I went on the internet, as I tend to do, and found a business projection website. I don't remember the name, but it actually is projecting now a significant downturn in tanning industry revenues, and we're finding a lot of the indoor tanning people are now branching into other businesses. So I think we're making an impact. Why? Because we want to keep teenagers out of tanning beds. All right, we've seen way too many melanomas in young women, and we believe that indoor tanning has had a lot to do with that. My friend Boris Lushniak, when he was the acting Surgeon General, published this beautiful call to action on the prevention of skin cancer, and it was great. While we had a dermatologist as the Surgeon General, he was able to do this. And here's the good news. Over 40 states now have legislation that either prevents or significantly limits the exposure of minors to indoor tanning. In Tennessee, we're almost there. We have limitation for our teens. We haven't outlawed it completely, but they do supposedly have to have a, quote, notarized statement of consent from parents saying that they understand the risks. Well, this doesn't work. I mean, parental consent is a joke when it comes to tanning. And you know why? Because most teens who tan went there first with their mother. So as I like to say, they're not only doing it with their mother's consent, they're doing it with her blessing. So I'm all for, we don't let our teens smoke, we don't let them drink alcohol, and I don't think we should let them into tanning beds.
How long has that been in Tennessee? I don't think it's been.
Martin, do you know how long we've had this?
No, it's been a while.
This is the existing legislation, but I don't think there's any enforcement at all. And that's one of the biggest problems. In fact, that was the When I was pushing the tanning legislation in Vermont, the governor tried to shoot down our bill, and his argument was, well, we have no way to enforce it. We don't even know where the tanning beds are. To which I looked and I said, you know, the Yellow Pages would be a really good start, but, and I won't even tell you about then how he tried to attach a Death with Dignity bill to that bill. So we prevailed. You can't tan in Vermont, at least. So there is some limitation, but I can tell you there are some very interested parties in this room who are going to, yet again, try to completely outlaw it in the state of Tennessee. The good news is we're getting help from the federal legislation, the FDA. You know, we're getting some very high-level pressure now to get rid of indoor tanning. I don't know that we'll get rid of it completely, because once you're an adult, you're allowed to do all sorts of stupid things if you want to. But at least we can protect our vulnerable teens. And as I said, we would love to get rid of it. And I think that on a positive note, maybe one of the best ways to get rid of indoor tanning is to make it financially not viable. And once it doesn't pay, we can at least get rid of that aspect. It's harder to convince people that they don't want to have bronze skin, but I think we're getting there too. I think if you notice, if you look back, and I'm weird enough to do this, I've gone back and looked at ads in teen magazines over the years, and gone from the time that we had the Audrey Hepburns and stuff with the white skin, and then they're the light skin, and then it got darker over time, and then all of a sudden now they're going back to getting lighter. Because the good news is if you tan, you also get wrinkles, so hopefully we can work on that. So I'm going to stop there, and I think in the interest of time, we'll probably move on with our next speaker, but I will be around if you have any questions. And I appreciate your interest, and I hope that if we do go forth with the rally to outlaw indoor tanning for teens, we can count on everyone's support. So enough for the political message today. Thank you for your attention.